Thank you very much. It's a real honour to be here with you this afternoon. But I was a little bit perplexed because I was asked, as is the way, to make a declaration of my interests. And I didn't quite know what to put because I'm not a medic. I don't work in the health sector. I'm a consultant and coach of leaders across many sectors. And in fact, I haven't done much work with health leaders at all. So I hope that doesn't mean that the hall is going to clear at this moment, but it does mean that I don't have anything to declare. I'm not invested anywhere. But I did think, on reflection, that that was actually not the whole story, because obviously I'm a recipient of the health service that everyone provides. And I'm a funder of the health service in England. So I am invested and I do care. But I also thought that this might be a reason why you asked that question. You want to know my motives, don't you? You want to know if I'm invested in some way that means I'm not going to tell the truth. In fact, you want to know whether you can trust me. And in fact, that's what really I want to talk about today. I want to talk about the role that leaders in complex, interconnected systems need to do in order to create trust in the system. Because without trust, the system doesn't work. Christine Lagarde made that statement a couple of months ago in London, and she was talking about economies, and she was talking about whole interconnected systems around the globe. And of course, we already know that globalization and technology and all the things you've been talking about at this conference mean that actually we're all interconnected. The question is, does that make different demands on leaders? And I think it does. I think it makes a real difference on what leaders need to be able to do. So here's the health warning on what I'm going to talk about. It's not complicated. It's not intellectually demanding. But that which is easy is not necessarily, that which is simple is not necessarily easy. And what you, I hope, will take away from this session is a reflection on your own practice as leaders and what you need to be able to do to work in systems that are this complex and this interconnected. When I went to university, which is more years ago than I care to remember, I studied zoology. And this stuff that you see on the slide is called slime mold. And zoologists love it, okay? And even zoologists that have gone on to be leadership consultants love it. And the reason that they like slime mold is that this stuff that you see, and you see it on the barks, damp places and trees, is actually not one organism. It's millions of single-celled organisms. And most of the time, single-celled organisms work perfectly independently of each other, and they're quite happy. When resources are tight, and in this case it tends to be water or food, then the cells aggregate together, and they form this mass. And they aggregate not just to huddle up together, they actually send out a chemical messenger, so they start to communicate with each other. And the whole superorganism works as one, and actually can work quite intelligently and go and hunt for food. So you can see where I'm going with this. It's a good metaphor, isn't it, for complex systems where resources are constrained. And I would suggest that health would be an example of one of those systems. It sounds simple, and it probably is. But when you come to put leaders into situations where resources are constrained, and I'm leading part of the system, because remember, like slime mold, no leader is looking after the whole of the system, bad things happen. So it's been my misfortune to watch leaders sabotage each other, blame each other for it going wrong, and in some cases, try to take the whole job on themselves and burn out in the process. So leaders need to be able to work in complex situations, and they need to understand what this collaboration stuff is really about. If you understand these two things, and this is what I'm going to cover today, then you're probably on the right path. Because leaders that we see who are successful within complex interconnected systems know where collaboration is required and know for themselves how good they are at it, whether they like it, whether they enjoy collaborating, whether they can adapt to those complex situations. So in order to explain this, what I'm going to do is not talk about health, but talk about a different business altogether. I imagine many of you have visited London, and if you have, you'll probably have used the services of this organisation. It's an organisation I know really well. It's London Underground. And London Underground is fascinating because it's the first metro in the world. It's just achieved its 150th anniversary. And there's a big problem with that. And the problem is that it's built for a much smaller city than London is. The stations are too small, the trains are too old, and for many, many years it wasn't invested in. Does that ring any bells? Around about the turn of the century, the government said, we can't go on with this anymore. London is growing. We have to invest in the system. So they set up something called the Public-Private Partnership. If anything was misnamed, it was that. There wasn't a partnership. Okay? And we were working with London Underground as it tried to cope with all of this change. And it was clear that it wasn't going to work. The people that would benefit out of the PPP were lawyers. They weren't the travelling public, and they certainly weren't the people that were working in London Underground. And they did, because the PPP went bust. And all of us who are taxpayers in the UK have actually paid a great deal of money for an upgrade system that didn't work. So what we had to do was the government had to say, OK, that didn't work, but we still have to upgrade the Underground. So they now finance it directly, as they probably always should, to London Underground itself. I guess they didn't trust London Underground initially to do it well, perhaps with some justification. So what they did was they said, OK, we want you to upgrade the Underground, but just remember, you've got to do it really efficiently, you've got to do it within budget, and by the way, you've got to minimise every possible way of disturbing the travelling public. So you've got to keep the system working. So the leaders in London Underground have got two big objectives. They have to upgrade the Underground, and they have to deliver an ever-increasing and more reliable service. So that's pretty tough. Want you to move on a little bit now, because we're going to make their situation really bad. I'm going to take you to the 6th of July, 2005. On the 6th of July, I hate to say this in such a lovely city like Paris, but on 6th of July, London was awarded the Olympic Games. And I was with the leadership of London Underground that day and the next. we were having a strategy workshop. And that night, the London Underground leaders were having dinner, and they all started by saying, isn't this great? We've got the Olympics coming. It's fantastic news for London. It will bring all this business. It's fantastic. And then as the meal went on, they became more and more depressed. So by the end of the meal, they were saying, how on earth are we going to be able to deliver the system? The world will be watching us. The whole basis of the bid was public transport for the Olympics. By the end, they were really worried. Let me take you to the next day. So the next morning, woke up, had breakfast, went down to the meeting room. 8:30 in the morning, all the pagers of every member of the leadership team went off around 8:30. There had been an explosion on the underground. No, there had been 2 explosions. And as we now know, there was a terrorist attack. The tragedy, 55 people dead, hundreds injured. So just put yourself in the heads of those leaders. They had to upgrade the underground, and they had to improve the performance of the underground. They had to deliver an Olympics and move everybody to the Olympics. And they also had been internally destroyed as a company through the terrorist attack. People had seen things they shouldn't have seen. People had to deal with things they shouldn't have had to deal with. So, if you want a challenge, they had some, okay? And it was really quite a dreadful time. However, London Underground understand that they can't do it all on their own, and they understand that collaboration might help. So, they have that, okay, burned into them. Now, if you've travelled on the tube, you will know that at the gap where the platform edge is, it often says, mind the gap. And you'll see announcements that say, mind the gap. Why do they say that? That's where injuries and sometimes fatalities happen. And interestingly enough, it is the split in their organisation too. It's where the trains organisation and the stations organisation join up, is at the platform edge. Think now, in your job, in your world, where are the platform edges in your organisation? These are the points of interdependence where groups from different parts of the organisation have to come together, make a decision, work collaboratively in order to deal with the situation. In London Underground, what they do is the trains organisation, the stations organisation work independently most of the time, except when a train breaks down. Train breaks down in the tunnel, they have to be able to communicate that to the station staff at the next station, because otherwise they can't manage the crowds. It gets dangerous. So platform edges exist in all organisations, and because of the risk, London Underground have one of their core behaviours is collaboration. In other words, working together really effectively when we need to. But can I make the point to you that I'm not at any point in this presentation saying that leaders need to be collaborative with others all the time. Just like trains and stations, they only need to collaborate when the problem arises. The rest of the time, they just trust that the other part of the organisation is doing the right thing. That doesn't come easily. That trust is built over time. So look at this model and just think about it for yourself. It's called the spectrum of collaboration. So again, muse on it for your own situation. The leaders in the organisation, in London Underground, use this all the time. They take a particular organisation, other organisation, supplier, whoever it is, and they try and map them on this model. So they say, well, do we have to collaborate with them very much? And if not, then they say, well, that's really quite a transactional relationship. We went into one government department who said, we have lots and lots of partners, we have lots and lots of partnerships, and our partners say we're really frustrating to work with. And we asked them to tell us more. Found out they had tons of relationships with many, many organisations. And they called them all partners, and they really wanted to be close to them, and they could not deliver on it because there's not enough time. There's not enough resources to do that. So maybe you've got some relationships in your health system where you work which are just transactional. I say what I want, the other person, the other organisation goes and gets it, and then it delivers to me. We don't have to link arms and walk into the sunset together. We just have to do that. So relationships are of different sorts. At the other end, we have the old symbiotic, really tight team relationships. That is rarely required outside a close, functional position within a system. A whole system does not need to work like a team. A whole system needs to look somewhere in the middle. It needs to know where the points of interdependence are, know how much collaboration is required, and the leaders focusing their efforts on those parts and those parts only. And the reason for the arrow is that you build collaborative trust in a system by starting at the transactional end. In other words, do people keep their promises? Do people who you work with, and do you keep your promises? As a leader, if you can't do that, and it's not possible to do that, there is unlikely you will develop complex, truly collaborative relationships that probably the system requires. So just for a second, okay, how many people would say for themselves they were the sort of person who instinctively liked transactional relationships? Few hands up. Who really likes building teams and really close relationships? More. To be honest, we're all wrong, okay? Because our preference might be to work in one way or another. The needs of the situation are likely to demand from you that you work out of your comfort zone somewhere else. So again, hard analysis of where collaboration is really required is the starting point. Here's another man. Sorry, he's a man. But he's quite famous. And it's Lincoln. And I don't know if you've had the chance. If you saw the film, it's easier than the book. Okay? But this is the book on which the film... Actually, the film is based on about 2 chapters of this book. And the book's called Team of Rivals. If you've got a long holiday, then I'd suggest just give it a read. It's a great book because what it does is it describes a challenge that Lincoln had. One big challenge. He wanted to achieve 2 things that many people said to him were self-contradictory. He was required to make peace, and similarly, he wanted to abolish slavery. The 2 things required him to work with what he called his rivals. In the health system, certainly in transport, certainly in all the other sectors we've worked in, you have to work with your rivals, and your rivals will have different objectives. And I imagine you know that from your own experience. The demands of most leaders are self-contradictory. And there, I think, is probably the definition that I like best of what leadership is. It's not management. It's achieving two things that seem impossible together. I imagine that you find that in your own roles. What did Lincoln do? Well, actually, he spent a lot of time in Congress and a lot of time in conversation, and there's a room in Congress where he actually went, and he debated with his rivals, and he, over time, built trust, built relationships, and built enough of a coalition of support to achieve both ends. That's what working in a complex system is all about, and that's what collaborative leadership aims to achieve. Now, this is one of these simple slides that kind of covers a multitude within it. So, if we're looking at leaders that can cope in these systems, what do they spend their time doing? And they spend their time fundamentally doing three things. Building relationships so there's a bit of trust in the system. So that means not just talking to people when it goes wrong. When it does go wrong, they constructively are able to handle conflict. In a complex system, you cannot design out conflict. The PPP in London Underground wanted to define every single situation perfectly, so there was never any conflict. You knew exactly whose fault it was and how to pay. You can't do that. Most of the leaders that we see that fail because they talk tough, but actually when there's conflict, they can't handle it. And the third thing that collaborative leaders need is an ability to both understand that they cannot control it all themselves. We worked with one IT supplier who managed to ruin an IT outsource contract, cost about £70 million sterling, and he did that by being unable, absolutely in his DNA, unable to share control with any other organisation. Sharing control is the most sophisticated end of leadership because it means that I have enough personal confidence, personal belief in myself in order to give some of that away to other organisations and to peers. So if we take these two elements we've talked about and put them together, an awareness, what sort of leader do I like to be? How's my attitude to collaboration? And the other side, how much collaboration? Where is the interdependence? What is the requirement? And we put that together. As a leader, I need to balance three things. I need to balance how I govern the organisation or that relationship. So when should they talk? Who's responsible for what? What are the roles? How do we make decisions? However, too much of the governance and we end up with a bureaucracy. Remember the PPP contract? If you look at the BP disaster in the Gulf and you read the President's view, the President's commission on why it went wrong, you will see that governance played a big part. Nobody knew who was responsible for what. Second part is operations. What data do we look at? What information flies past the different parties? What are the leaders doing with that? Too much focus on data, and we get data overload, and it doesn't matter. We don't look at it anymore. Reports never read. And the third thing is behaviour. Behaviours that build trust, behaviours of openness and relationship, behaviours of empathy and patience. How many leadership programmes focus on empathy and patience and the ability to build relationships, influence others, and handle conflict. It's drawn very badly, I apologise, as a three-legged stool, in order to make the point that you have to balance all three elements. So leaders who are working in collaborative systems have to do that. And if they do, the payoff for the leader, and this is the point that I think is worth thinking about, your selfish payoff is self-confidence. You feel better as a leader. You're achieving more in a complex system. And I could stop there, but I've got one more bit. There's an arrow missing. And that arrow says, increasing self-confidence is dangerous. It might be all right, but it's dangerous. Think about parts of the health system that have gone wrong. In the UK, we've had one or two local difficulties recently, and they've come from leaders, individual leaders, whose self-confidence believes that in their system they just know it's right. They have the right answer, and they have it on their own. And the danger is that leadership becomes unhealthy and destructive. So there is collusion. The leader gets other people to agree with them through manipulation, through poor communication. Or the leader coerces others to their point of view, even though the other party might disagree. And finally, and it's been my misfortune to see it, some leaders just burn out under the pressure. They try to do it on their own. They cannot share control. And I have a sort of slight antidote for it, and it's this book here. I was given this book, which I'm really promoting much more than mine, because it was given to me by a colleague of mine, not a colleague, a friend of mine, who is in the NHS. He's a psychologist. It's called Intelligent Kindness, and it takes these points on what goes wrong in this case, the NHS, and what has gone wrong, and it actually promotes a different way. And I think it's got a lot to say in your sector, and I'm taking the messages from this and promoting them into other sectors. It's a great book. I encourage you to read it. Fundamentally, how do leaders stay healthy? It's another simple list, okay, but it doesn't make it easy. Leaders need to be actively asking for honest feedback. They need to have courage to know what they're good at and what they're not so good at, and build their own colleagues around to fill the gaps. And let's face it, leaders need humility. And they need humility for one reason more than any other, is to ask for help. How many leaders, senior people in every organisation, think that's not possible? And they don't think they can ask for help from more junior people in their organisation. So it's really no different from becoming a healthy human being. And I suppose that's what my friend was trying to tell me. However, I want to go back to London Underground, because we've left them with these multiple challenges. And there were 7 years to the Olympics, and LU had been, partly destroyed by the process. And they embarked on the largest staff engagement programme that I've ever seen. in order to both help the organisation grieve what it had lost, celebrate the heroism of the people involved, and then move forward into the future. There was not limitless resources to achieve this, so a bit like slime mould, they had to aggregate together. And indeed, in addition, they had to find links with other parts of the transport system in order to build a plan for the Olympics. And it was fabulously successful. It was extraordinary. I was with the team on the day, and they were so worried. They kept on saying, but what if something goes wrong? What if there's a bomb? What if? They sustained themselves. They had built a plan. They had built relationships. They had trust in colleagues who they knew not really very well in other organisations. But they had worked together to build the plan. And what's really important is to put a face to all this, because I didn't deliver it, none of you did. But this guy is called Mike Brown. And Mike Brown is the managing director of London Underground and London Rail. And he gets this stuff. He gets it big time. He moved his office, to the Olympic Park for 3 months. He ran workshops for every single member of staff, 7,000 of them in his organisation. He answered all their questions. He wasn't just there at the beginning. He went through it. He personally put his personal reputation out there. And he probably wouldn't be in the job now if it had gone wrong. He would have been removed. The politicians would have seen to that. And he really did do it. So I saw Mike on Monday, and I told him that I was coming here. And I said, what's the message that you would give to the audience? If I can find it, I'll tell you. He said 2 things. One, he said, we couldn't have delivered anything, and we don't deliver anything, without moving from adversary to collaboration. And he said, collaboration isn't friendship. And the second message he wanted to give you was, if you're in a complex system, in the likes of health, and you want to approach things in this way, have the courage of your convictions to see it through. Plenty of people have said to Mike, you're taking the wrong approach. But his results over all these years prove that he can deliver. He's delivered the Olympics, he's delivering the upgrades programme, he's got the best performance of the Underground ever, and he's got a workforce that got past that terrible disaster. So collaborative leaders can make a difference. I hope that gives you some inspiration that you can use some of these approaches in the health sector. Thank you.